Patients should be referred to an infectious disease specialist immediately upon finding out that they have a periprosthetic joint infection. Here at Ohio State University, we use a team approach, a collaborative approach to treatment of periprosthetic joint infections because they are so complex. So I have a team that we've gathered over the past 10 years, and they're all equally important, and the infectious disease professional is somebody that we invite in on that referral and on that consult immediately. They're the experts in determining which antibiotic we're going to use. If we need to change antibiotics, they're very careful with looking at any adverse events. Many of the antibiotics can be toxic to the kidney. And oftentimes bacteria can develop resistance to the antibiotics that we're using. So we utilize all their expertise in this area.